Today's medication is called phenobarbital, and it's also known by its brand name, which is luminol. It falls under the class of barbiturates and anticonvulsants. Its mechanism of action is that it acts on the GABA receptors and decreases the overall neuronal activity. This slows the impulses of the brain that may result in seizures. Your indications are going to be status epilepticus and treatment or prevention of seizures. And just a heads up before we get into dosages, phenobarbital is not something that you typically see on the ambulance. It may be a long-distance transport drug, but most likely not. You're usually going to see it in the hospital. And as always, abide by your local protocol and stay within your scope of practice. Your dose is typically going to be 100 to 250 milligrams slow IV push or IM, and the pediatric dose is 10 to 20 milligrams slow IV or IO or IM. Contraindications of phenobarbital are advanced liver or respiratory disease and porphyria. Adverse reactions can include dizziness, drowsiness, headache, hypotension, respiratory depression, CNS depression, nausea and vomiting, bradycardia, and ataxia. As for drug interactions, phenobarbital can and will interact with benzos, narcotics, sedatives, hypnotics, and alcohol by increasing the overall CNS depression. You want to flush the line before and after, and it is not a medication to be given through the line at the same time as another. And phenobarbital is supplied in several different ways. It could be in a 30, 60, 65, or 130 milligram vial or ampule in 1 milliliter. And just a few quick side notes about phenobarbital. It can cause irritation to the vein, so it is important to try and locate a larger vein if possible. And just like I mentioned earlier, you want to flush the line well before and after. Your peak effect is approximately 30 minutes, and you just want to be aware of the high chance of the elderly experiencing adverse reactions. So you could consider reducing the dose depending on what your protocol is. As always, guys, remember to abide by your local protocol and stay within your scope of practice. This video is purely informational for those in the EMS field and never meant to be used in the place of medical direction, local protocol, or formal education. Thank you so much for watching, and I'll see you next week. Bye!